So on safe patient handling, always remember to have your gait belt on you. And we're gonna go by step through all the devices that we use. So that will be good. Hopefully if you have any questions, let me know. Hoyers are always 2-person. Sit to stand and stair studies 1. I know in our videos they were not perfect. There was some stuff that was not the greatest, but those are the best videos I could find. So there are some things that we are going to go over that's different than what the video showed. So in the stair study, they didn't use a gait belt, and that is one thing that PT has asked us to use as a gait belt for them. The other thing is they did say that you could use it to haul the resident down the hall. PT has requested that we don't do that because if our patients don't have the upper core body, they could fall out. And a lot of our patients have dementia and they might not remember to stay holding on, and that's a safety issue for us. So, okay, so I'm gonna do the best that I can do, especially with one-handed. So we are going to work on the Hoyer, 2-person Hoyer. So Taylor, you are gonna have to come, my dear. So we will have you lay on the bed. So our slings, we have different sizes of the slings, and you need to pick the one that will best fit that patient. There are 2 different kinds of slings that we have. We have ones that you can slide underneath their legs, and we have the full body ones. The full body ones has to stay underneath the resident at all times. But if you use these, they really prefer us to take them out once you put them in the wheelchair. So when you are putting this underneath them, all right, we're going to get the Hoyer sling underneath you. And always communicate with your patients as much as you can so it doesn't freak them out. The handles go in the back. All right. No, I want to do this way. Sorry. Okay, so I'm going to roll her towards me since I don't have a side roll over there because I don't want her falling off the bed. So we're going to come this way, bend your leg, and this should come right at her backside. Sorry if I mistouch you.
It's okay. I'm a mom, I mean.
And you're going to roll it up like that, and then you're going to roll back. And you're going to roll towards me. And you're going to roll back. And there's 2 different ways you can do the legs on this one. So bend your legs. We're going to put this, you can put these completely across like this, especially if you have a very petite person, and go like that. Or you can come up between the legs, and then when you come up between the legs, you're going to cross them for safety. This is obviously too big of a sling. All right, Jessica, I'm going to have you help me. Okay, so when you are Hoyering them, you're going to make sure that you lock the Hoyer. The bed is up if you need to raise it. You are going to hook the 2 top ones at the same.
Here, let me go down for you.
No, don't go down. I'm going down. There you go. All right. So we're going to go white because we're going to put her in a wheelchair. And you're going to do the same one. And then on the bottom, we are going to do blue on your side and blue on the side.
Okay, I have a question.
Yes.
So I have seen when we're loading them, see where your upper cross yellow piece, the top of the sling? So I've seen it being loaded where that is up by the neck. And then I've also been told that it needs to be like below the shoulder length, below the shoulders behind them.
So
Where does that need to be located?
this one right here.
Yes.
So it should be at the shoulder length. You should have it right here at the bottom, and it should hit the shoulder length.
Right at the shoulder and not at the neck.
They will slide down in it, so it will probably hit. If they're so tiny, you probably need to get a smaller sling.
Okay.
but you really want it at the shoulder length.
Okay.
So like this needs to be.
Yeah, and it will slide up.
Okay.
Because the other problem with you is you're long and you're skinny.
Sorry.
So, and then the legs are gonna be, I'm gonna open the legs. All right, up we go. Keep your hands in. They really do not want them holding on. They really need to have their hands crossed and inside. Some patients like to hold on right here, but really watch it.
Some patients also like to hold on right here.
Yeah.
Cause I don't do it all the time, I always get confused at which loops to use. So if they're sitting, you want the smallest
Yeah.
here, and if
So
laying
they're in a
down,
more of
you
a
use
sitting.
the-
There you go. Yep. All right, so you want them off. We are going to unlock and swing you over to the wheelchair. And you always want to make sure your wheelchair is locked. Okay. Always watch their feet.
Go this way, and then I'll switch your spots so I can, handle it, handle the position. Okay, you wanna drop it down?
Make sure her hands and feet, hold on, I gotta lock the Hoyer and put them down. We are going down.
Okay.
And you always wanna watch their head. So the person controlling it really should try to watch the feet and the head, because a person pulling has a hard time not doing that. Pull it back. There we go. Any questions? All right. So technically the Hoyer sling should be taken out from underneath them. And when you do that, you're gonna have them lift their leg up. Try not to get their foot. And if you have them lean with you and pull it out, and that's the same way as you're putting it in. So if you go to put it in, and I've noticed some people have issues with this, have them lean forward and just tuck it below underneath them. And then what I do is I have them lean towards me and I go alongside this side here and go right out along. Have them lift up this leg and do that with the other leg. So I'm gonna have them lean and just go right along. I feel like I'm violating you.
No, you're fine. You're fine.
And up around, just like that. Okay? Any questions? Okay, we're good with that one.
Good.
All right, so we'll do the Sarah study next so that they can use it if they need it.
Oh, you can. No! Do you have it in here?
No, it's in the hallway. There's not enough room. Okay, we can do the sit to stand. If the Sarah study's gone.
Drop your Snickers. FYI.
Must be 15.
Awesome, thank you. Okay. With the sit to stand, there is a couple different slings that we have. We have these ones that work a lot better for some of our residents. They have more cushion. And then we have just a more basic one that goes around. When you put these on, you always want to try to get them down around the waist and not like really up high. Oh, there it is. All right. All right, Miss Taylor. You can come back, sit in the hall.
You want me in the chair?
Yeah. Actually, we're gonna sit you like this so that we can get you into bed. Okay. Okay, so when you have them in the chair, and you're gonna hook them up to the sit-to stand. You're gonna make sure the wheels are locked on the sit-to stand, or on the Hoyer. On the wheelchair.
We knew what you meant.
All right. Well, that's a good thing. Okay. And so you want to make sure you have the right sling. We do have different sizes. The handle goes up on top. And I'm going to have her sit forward. And I'm going to put it down as far as I can get it. Have her bring her arms up. And obviously this one is way too big for you. Let me see.
I can kind of help with you. We'll make it work.
Okay, well, he might work with that one. It's right there. Okay, so
Is that gate belt snug, or is that a little looser than when you would do a gate belt?
that is, I get it as tight as I can, but as you raise them up, you're gonna have to tighten it. Because it will loosen up as they stand.
Just like a gate belt.
Yep, so you're gonna have to tighten it. All right, so. You bring this in, have them put their feet on. Watch their feet, you want it on the black, not up here. And their knees up. You're gonna lock the sit to stand. Bring it down. And with this one, you try to go, you kind of use how big they are. Their size determines on what you put it on. But whatever you put one side on, you're gonna put it on the other. So we're gonna do white, because she's so small. All right, so then I'm gonna have her bring her hands up and grab the bars. And as it comes up, stand up with it. Do not let it pull. If it's pulling them, educate them, try to encourage them to stand up with it. So we're gonna stand.
My core.
And as it goes, it's gonna loosen and you're gonna tighten it.
I'm scared of going back.
Some people you won't get to stand straight up. Some people you're just gonna have to, we have a couple of them where they couldn't stand all the way up, but you judge it. And then I'm gonna unlock and we're gonna move.
Okay.
All right, and you're gonna bring them out. You're gonna put her underneath the bed,
So
walk.
when I was watching the videos, when it moved, it had you put the legs in. on
Right,
this-
I noticed that. When Katie and Tina taught me, you leave the legs open because they could always tip.
Yeah.
Okay, we're gonna sit.
Okay.
Yeah, I was just
Yeah.
curious. 'Cause
I noticed that too in all the videos I watched, had the legs closing. And they were doing it one person, the Hoyers. I really couldn't find an accurate, not what the way you guys were trained to follow that. So then you're gonna bring it down, you're gonna unhook, have them sit up. Hopefully they can sit up their core.
Does it matter which one of these?
No, not really. If they're pulling back and you need to, you can use this one. We try not to use this one. Most of the time when we've used this one, people end up with bruises on their fingers, so we usually just use this one. And we'll bring that out. You're gonna take this off, put it, and then you're going to, hopefully they can help you lay down. If not, have your hand behind hers and lift her feet and have her help you turn into bed and lay her down.
Do you want me to take that and bring it to the Sarah station?
Would you?
Yeah.
Thank you. Any questions? Okay. Okay, you can sit up on the edge of the bed.
Pink thing is slippery.
I love the way this thing moves.
These things.
All right, Sarah said he kind of is the same way as a sit-to-stand is, except you don't, it's all, yeah, and faster,
It's sit to sit.
right?
Yeah.
With, with the Sarah Steady, you don't have to have the legs open. They can be closed. So depending on some of the wheelchairs we have, you can't open it because our wheelchairs are too wide. So you can go keep them closed and keep them underneath, which is nice. This one you don't have to. So on this one, we are gonna open the legs. And I always forget about these things. There we go. All right, put your feet on. You want them on their feet up far enough, but not too far. Okay, back. There you go. You got it? Okay. You're going to lock it.
You want their knees touching it.
Yeah. And you're gonna put the gait belt on. With the gait belt, we're gonna go as low down on their waist as we can. All right. Okay, so what I want you to do is grab a hold up here, and I want you to stand up. And then sit the seats down. Have them go ahead and have a seat. Are you okay?
Yep.
Okay. And then the wheelchair is going to be locked. All right. And we're going to unlock and we're going to move over to the wheelchair. Nope. And when they're over it, lock the sit to stand or sir steady. Have them stand back up. Lift these up. All right. And then you can pull back and sit down on the seat. Just like that. All right, go ahead and pick up your feet.
Do you know how much that piece of equipment costs?
It's, I believe when I looked at it, it was like 3,000, 4,000, something like that.
Less than a-
It was like 3 or,
That's not
it's either 3 or 5. I can't remember.
Like this a lot.
Well, I'm gonna leave that on.
That's right.
We normally wouldn't leave the gate belt on, but I'm gonna transfer her the other way. So any questions on the Saraseti? You can use it on the toilet. The only thing with some of our toilets is they have the bars. So you kind of have to maneuver a little bit with that. But you can sit them on the commode, you can sit them anywhere. Just don't transfer them long distances with
I
it.
do have a question. Can you like stand them up to a sink, brush their teeth it with it? Or like comb their own hair in the mirror?
They're moving their body weight, so I wouldn't think it'd be safe.
It's, okay, so it says you could. In the book, it says it's mainly made to transfer from side to side, you know, from a chair or whatever. I know when I talked to PT, they said you could. The only worry is with our patients is that core upper body and their dementia, if they're going to, it's going to be safe. Because they didn't buy the belt for it. It'd be a different story if they would have bought the belt for it to hold them in like we do with this sit to stand. But since we don't have that, that's the other thing that stops us from doing some of that. So really, you should put them in their wheelchair. So, for safety reasons, yeah. Okay. Thank you, Dawn. All right, so the next one is the slider board. With the slider board, has any of you guys used a slider board before? Okay.
Just training.
So you want to lower your bed. You're going to put the wheelchair at a 95-degree angle. Most of our wheelchairs, the armrests come off, which helps us a lot. And, well, okay, that came unlocked. Okay, now it should. Okay. So we're going, and always remember to unlock the patient. Always remember. Put them at a 95-degree angle. All right, so we're gonna transfer with the board over onto the bed, okay? And you gotta have a gate belt on for this. So if the armrest can be removed, please remove it. I have 2 boards you can use. And it really doesn't matter which board you use, but I'm going to use the longer one for
So
you.
size matters, doesn't matter?
No, not really. This one's a smaller one, so if you have a smaller distance, you might use this one. With going from the wheelchair to the bed, it's a little bit longer distance. And since they can take their time getting over, I'd probably use the longer one just so you had that stability. And you don't have to worry about it moving off. All right, so what you're gonna have her do is you're gonna have her lean. Okay, first of all, come forward a little bit, if they can. Okay,
It's on, yeah, it's on Taylor.
and then,
Yeah, it's on Taylor.
all right, so you're gonna slide it underneath their hip. Okay, you good?
Yep.
And sometimes the bars still get in the way. So what I'm gonna do is I'm gonna turn it a little bit. I'm gonna kind of lay it flat. we should be good. Okay, so it will be up a little bit because she put her weight on one side of it. So what we're gonna do is you're gonna put your feet in between hers, and what we're gonna do is we're gonna slide across, okay? If you can help me, please help me.
I will help you.
All right, so push off here, and you're gonna slide your bottom across.
Okay.
You ready? All right, on the count of 3, we're gonna slide. 1, 2, 3. And see, she can sit right there, and if she needs to take a break, are you ready?
Yep.
And we're gonna go again. Just like that. And then if you can, and she's secure, pull the board out. Move the chair. And we're gonna take the gate belt off. And we're gonna lay down in bed.
Okay.
Just like that. Any questions? And you do the same going back into the wheelchair. And you can do it, you can use it in the recliners. Moving them from the recliners to the wheelchair. And they're always in my office if you guys ever want to use them. Okay?
Is there anyone in particular that this would be useful of our residents? I know we probably can't say names, but
215A could possibly use a slider board.
I don't,
That's what I was thinking.
cognitively,
Because if you're just sliding them over,
He fights you on that though.
he would have to feel confident enough, yeah, to
yeah.
put his arms down, move a whatever. And I don't think he can follow the directions.
He might not, but with this, he's on that board and you can slide. So if he's not able to stand up safely and you don't have the, you could possibly use this. Because all it does is kind of scoot him along the way.
I love this air study.
I would prefer the stair steady, but I mean, if you're in a desperate need and instead of doing a 1 to 2 person, because you could do a 2 person with this, 1 on each side and do him that way, instead of hurting your backs, just help him slide across that. I would prefer you to do that than lifting and hurting a back. But that would be probably the only one, or that. 216B could possibly use this. But that one's a little hard too.
Yeah, the hard part with her is getting her into the standing position just to get over to that. Or not.
Well,
Just be able to lift herself enough to get there.
right.
She can.
She could, yeah. The reason we kind of stopped, if I remember right, when I was an aide, was because we really didn't have patients to use them. But if we ever had to and we're in a desperate need, now you guys know how to use them, if you really had to. Would I use it on everybody? No, because not everybody's fit to use them.
I'd rather do a 2% transfer. That can kill your back.
Yeah, and this helps your back, because if you can't fully get them over, they can sit down and they're safe. That's the thing with these boards. You might not, I mean, they don't have to help you transfer, but just because it's slick and you can slide them and then they can stop if you guys need a reposition, it's a safety tool in a way. All right, so if we ever have anybody we have to put on a gurney and you have to slide over, there is 2 things you can use. They do have the hover mats now. Oh, thank you. Oh, I need that back.
Oh, do you?
Yeah, I still have 1 and 2 person transfers.
there's another gate built up there.
Okay, so we have, I'm gonna slide these out. We have these boards here back in my office, and these are to help, we used to use them to put people on gurneys instead of using sheets. So what we would do with this is you'd have 2 people. Shanna, you wanna help me? All right, go ahead and roll towards Shanna. We're gonna lift the bed up so we're not hurting our backs.
Yes, please.
All right, and what you're gonna do is you're gonna lay it underneath them.
Slide it
Yep.
a little bit more.
Okay,
I'm gonna go
And we're-
back.
and then we're gonna roll my way. And she's gonna pull it a little bit. There we go. All right, lay back. And we're gonna try to scoot them in the middle of the board. Over, there you go. So now you would have another bed right here, gurney, and sorry that I don't have one. And then you'd have people on the other side and you'd have people on this side and you would pull her and scoot her over, which will save your back. Any questions? Okay.
This is not comfortable, I'll tell you that.
Okay, we can roll off. All right. Shanna, will you do a 1 person transfer into a wheelchair for me? So Shanna's gonna show you how to do a one person. You always use a gate belt with the one person. Make sure your wheels are locked on your wheelchair. When you're doing this, you always want the bed higher than the wheelchair, so they're going downhill.
Yes. I'm gonna go just a little bit higher.
Wrong way.
Going the wrong way. Yeah.
Upside down.
There we go. That's probably good. Okay. And then I'm gonna put my feet between yours. All right. And bend down. All right, on the count of 3, I'm gonna have you stand with me.
Okay.
1, 2, 3. Okay, now we're gonna start turning. All right, now if you'll reach back and grab the handles.
Okay.
And we'll go ahead and set.
Just like that.
Even bending your knees.
All right, so now we're gonna do a two-person. Hold on, Shanna. We're gonna do a two-person.
It's like you've done this before.
So a two-person is pretty much the same as a one-person. I need to switch you sides. And since we're going back to the bed, we're gonna lower the bed. The only thing, the one thing I see a lot of is when people wanna do a two-person, one's in front and the other one's in the back.
Yeah.
You always both wanna be in front because you're gonna hurt yourself. All right, so I always put my foot in front of theirs because a lot of times their foot will slip. So I put mine in front of theirs. You're gonna go underneath. So your shoulder should always be to their shoulder and you should be aiming out, never this way. This is the other way I see it. You guys always want the outside shoulder,
Yes.
okay?
You gotta position their foot a little.
What?
That's the way I was taught, like to position their foot.
Oh, yeah.
Yeah,
Oh, yeah. Oh, like towards this.
Yeah,
That
so you want to aim your foot that way.
that way, yeah.
Always make sure that their foot is secure and their feet are ready to go
Oh,
the
I
same
see.
way.
I gotcha. Okay.
Okay,
Okay. On the count of 3, we're gonna stand. 1, 2, 3.
we're gonna go towards your right. Keep going until you feel the bed in the behind.
Yep.
All right, and we're gonna sit. Just like that. Always communication. You gotta communicate with your partner with doing that. Any questions? Okay. So, the pink slip is the other one. Go ahead and lay down. We have pink slips that we use to move people up in bed to help our backs. I know you're on one. There is arrows on them to show you how to position them underneath them. Maybe. Okay. So it says this side up to move it. So what you're gonna do is you would have them go side to side and you're gonna roll it underneath them. There's 2 ways you can have them if they are able to pull themselves up in bed. What you can do is put the underneath them, and I know the video had it up higher, but have them bend their feet. I would have, well, this ain't gonna work, but a pillow up at their head and have them push up from their feet with this. Okay, go ahead. It needs to be up higher. Hold on.
Let me scoot down.
Go for it. Yep. Okay.
Try to push.
Yep, there you go. See, and then she scoots forward, up. So she can do it that way without you having to do any work. The other way, okay, scoot back down. The other way you can do this with her is you can do it 2-person and, yep, feet up. And what I like to do is there's 2 different ways. Some people use a sheet over the pink slip that you could use. Some of the pink slips you can actually take and help slide them, but it's a little bit harder. So I would say either have a draw sheet between the patient and the slider or have a pink pad. It would work better. So I like to lift their feet up in bed so that I'm not working against. Make sure there's a pillow at the top so you don't hit their head.
We want to lift the whole bed up so we're not bending so low.
I guess. I was getting there. And then we're going to lift the bed up. Maybe. And if they can still help you, have them help you with their feet.
Tall.
Is that good for you?
Yeah.
Okay, I'm short, so. All right, so you can have them cross their hands, arms. And on the count of 3, we're gonna pull her up.
It
1.
doesn't take much effort.
No, it doesn't. 1, 2, 3. Just like that.
Perfect.
Now you're up high. You can do it with one person, but you have to be at the head of the bed. I prefer you not to do that because that's going to hurt your back even worse. It's easier to get 2 people, but not saying you can't do it one person.
When you're in a pinch, it'll work.
Yeah.
Those sheets are great. I love those.
These.
And they're usually they're usually kept in the closet, so. All right. Last one, and that is the hover mat.
How often are we supposed to change the bed sheets?
When they tear.
Yeah, when they tear, they look nasty. I mean, we have plenty of them in the back.
Are you good with me?
Yeah, no, you're back on the. We got one more. You can lay down. Okay. So the other thing that we will see is the hover mat. Sorry if I drop it. Okay. So a hover mat is always at least 2 people. You always want 2 people when you do this. And acute care has these, and so does ER. So if you guys ever need them, they're a one-person use. So once they are used, the resident keeps them. You can clean them. There is, there is instructions on it where to have their head and where to have their feet. So it's easy to know which side is up. Oops, sorry, I didn't mean to do that. And you're gonna roll it. And you always want them in the middle of it. Okay, roll back. All right, roll my way. Okay, roll back. The ones that were in the video has clips. Ours do not have clips to hold the patient in. So always have somebody at their side, especially when you have it inflated. Okay. Shannon, I'll have you help me. So there's a hole at the foot of it to plug in the blower. And the blower, this is odd when you only have one hand, will automatically turn on. Obviously this one does not have an on and off switch like the other ones do. So there is a spot for it.
Like that.
Yep. And you just kind of slip it over, as you guys can see. When you move them, it's gonna go with it, because once you pull that out, it's gonna deflate. Okay? All right, you ready? We're gonna inflate. And we're not.
It's on the hose.
That blue.
Oh, there we go. All right, so now it's inflated. You would have a bed over here, and what is gonna happen is she would go on the other side of that bed, and we would work, and I would push, and she would pull. You can have more than 2 people, but you at least have to have 2 people. All right, you ready? I'm gonna deflate it. When we deflate it, you want people at the side so that they don't roll off and fall, since we don't have them hooked on these. They're really nice to slide over. Makes it really easy. Ruth, you have any?
Oh, yeah, they're great. You have to watch it because they cover and they slide really well. So, like, it can get away with way from you throwing them across the room.
Oh no!
Pull them off the other side, or so, yeah, at least 2 people. Sometimes we have one person on each and one person turning it on and off, just
The
because.
bottom of it reminds me of those air hockey
Yeah.
It really will. Like, we've had more than one person that almost got pulled off the other side
Aren't
of the
they
bed.
mostly for your very large or spinal things or something? Wasn't there?
Or if it's someone that is maybe a little bit heavier and is gonna be hard for us to transfer, or like you said, neck injuries or.
It's easier, and you don't have to use as much force.
Yeah.
So really watch it for the rest of us that are used to putting a lot of force behind it.
You will, just
Yeah,
like.
somebody tiny like, are you doing?
Yeah.
Right, you just kind of direct the air and
Yeah.
it slide over by itself.
All right. Well, that's all I have. Any questions? Anything that